All right, the AP is reporting that the World Health Organization is big on travel and spending a good deal of travel, including five-star hotels, $1,000 night hotel rooms in Africa, you name it. Political commentator Ashley Pratte on going through a lot of these numbers. They are eye-popping. A lot of them come back at the World Health Organization, Ashley, to say, well, a lot of this was during the Ebola crisis when we had to send personnel, down to that neck of the woods and everywhere to track this, so of course it's a little out of whack. What do you think of that?
Yeah, you would think, Neil, that for an organization whose mission is to combat infectious diseases, that a bulk of their spending would go toward that. But however, they spent over $200 million of their $2 billion budget on travel alone, which I find shocking considering that combined total they spent less than that on combating AIDS, malaria, and tuberculosis. So for an organization that's supposed to be doing great things to combat these infectious diseases and helping people that are going through that, they seem to be living quite a lavish lifestyle, and the U.S. is the #1 funder here out of all the groups in the UN that are funding this organization. So I do see how this falls back on taxpayers and how it is a tad irresponsible of them to keep spending the way that they are.
All right, one that stood out to me was the WHO Director General, Dr. Margaret Chan, who had been working with health workers, I guess, in West Africa over the Ebola thing. She stayed at the biggest presidential suite at the Palm Cayman Hotel in Conakry. I hope I'm pronouncing that right. Which cost about 900 euros, about $1,008 a night. I wonder if she got maybe a Travelocity discount. She could have, who knows. But I mean, that in the middle of this just seems at least visually out of place,
Yeah, I don't think that she was booking on Travelocity or Expedia for these. I think that they were, charging this to, taxpayers here. But at the same time, I do think that it's a bit disingenuous for an organization that's supposed to be performing a service and, really looking out for the health and well-being of people all across the world to be doing this. And it just seems, again, disingenuous for them to go out there and say that they're working on combating these serious diseases when they're not even spending a combined total of that amount on three very serious diseases.
They say this was an unusual year, and we tried to get a representative on the show. The best we could get was this statement. I want you to react to it. WHO's travel expenditure in the calendar year 2016 was $200 million, a reduction of 14% from 2015. Less than half of these costs are for staff travel. Nearly 60% spent on travel of external experts to support countries and for representatives of member states. I think what they're saying is if you have medical experts or disease specialists or those who can follow infectious trends, those are the type that went there. And that's what made it the anomaly it was. But what didn't stand out there is that 2014 and 2015 were the high years of this Ebola scare.
Yeah, and the other thing, too, I think that there was a quote in the AP story that actually said one of the spokesperson or director for the World Health Organization actually said that they couldn't trust people to be making good travel decisions, which is a tad concerning as well, because why are your executives not trusted to do that? It doesn't make any sense to me. However, this again is part of bloated bureaucracy, I feel like, and there are so many organizations out there that are nonprofits that can do so much better and use that money more wisely, I think, in my opinion.
Yeah, anytime government funds are involved, you just have to watch it. You just have to watch it. It's not entirely government funded, but you do have to watch it. Ashley, thank you very, very much.